Hello, everyone. Welcome to today's panel discussion on how to encourage and facilitate organ donation during COVID. And this discussion is a part of the organ donation drive organized by Times of India Group and the Kokilaben Dhirubhai Ambani Hospital. And today we have with us Honorable Health Minister Mansukh Mandavia. And apart from him, we also have an esteemed team of panelists. We have Dr. Aarti Vij, who heads the Organ Retrieval and Banking Organization at AIIMS. We have Dr. Naresh Trihan, the Chairman and MD of Medanta Group. We have Dr. Santosh Sethi. He is the Executive Director and CEO of Kokilaben Dhirubhai Ambani Hospital. Dr. S.K. Mathur, the President of Zonal Transplant Coordination Center. Dr. Mohammad Rela. He is the head of Dr. Rela Institute and Medical Center. Sunil Shroff, he heads the Mohan Foundation. So we'll just start with the panel discussion. We all know how crucial it is to augment organ donations. We also know how the pandemic has affected organ donations across the country. So without wasting any time of all of you, I would straight go to the questions. And due to the shortage of time, I would like to keep the discussion a little brief. We will hear all views from all the panelists, and after that, the minister will have his say. So, first to Dr. Vij, you had the organ donation transplant program at AIIMS. So, could you tell us a little about the experience during the pandemic, and what do you think is your suggestion on how to improve organ donations?
Thank you, Dukesh. It's my honor and privilege to be here in such august gathering. And really grateful to our Honorable Minister of Health and Family Welfare to spare his precious time to be with us today for such an important topic that all of us together have been striving to work hard for decades now to come to a level of international level. Thank you, sir, once again for sparing your precious time. Durgesh, as far as AIIMS is concerned, we started this organ donation activity way back in 2001, where there was nothing happening in any of the government institutions in the country. So it was like, deep diving into a sea. There were no national guidelines and there were no protocols laid out at that time. We started with the help of national experts, many of whom are present with us today, and worked on many guidelines. Slowly, when we started, there was nothing known to general public in India other than eye donation, very little. And then the concept of brain death was a very major roadblock that we all had to work on. A lot of activities were done, workshops were done, awareness programs were done. And today we are, after so many years, are at a stage that most of the people know that heart, liver, kidney, etc. can be transplanted. So it has been a journey. Here I would like to...
Dr. Vij, I'm sorry to interrupt. Just a sec. The minister wants to speak first. He has to go for some other meeting. So, sure. Mansukh Mandavia ji, I would request you to please say something about organ donation and how the government wishes to encourage and augment this important facility.
Sorry, thank you. आपका एक अच्छा डिस्कशन चल रहा था और मुझे और कोई एंगेजमेंट होने से मैंने सोचा और मैंने रिक्वेस्ट किया कि मुझे अवसर दिया जाए. मैं जो आपके डिस्कशन में डिबेट में पार्टिसिपेंट हुआ होता तो मुझे और कोई आपकी ओर से भी सुझाव मिलता, लेकिन मैं अपेक्षा करता हूं कि आपका डिबेट डिस्कशन से जो कुछ निकलेगा ये मेरे संज्ञान में लाया जाएगा, क्योंकि यही गवर्नमेंट का काम होता है कि जनता की नीड क्या है, स्थिति क्या है, एक्सपर्ट ओपिनियन क्या है, ये ओपिनियन के आधार पर हम नई पॉलिसी कैसे बना सकते हैं और ये पॉलिसी का इम्प्लीमेंटेशन करके जन सुखाकारी कैसे बढ़े, वही कुल मिला के एस्पेक्ट होता है और ये ऐसे कार्यक्रमों से ही निकलता है. मुझे तो आज प्रसन्नता भी इस बात की है कि टाइम्स ऑफ इंडिया और कोकिलाबेन धीरूभाई अंबानी अस्पताल मिलकर टाइम्स ऑर्गन डोनेशन ड्राइव कार्यक्रम कर रहे हैं और ऐसे कार्यक्रम ये बहुत आवश्यक होता है. ये कार्यक्रम के माध्यम से हमें जो सुझाव मिलता है, ये कार्यक्रम के माध्यम से जो कुछ आउटपुट आता है, वो मुझे लगता है कि एक नई दिशा तय करने में हमें सहयोग भी होता है. और जो ऑर्गन डोनेशन है उसके प्रति अवेयरनेस आना, ऑर्गन डोनेट करना, ये आज के लिए इंडिया में सबसे बड़ी आवश्यकता भी है, क्योंकि हम हमारे देश की जो रिक्वायरमेंट है उसमें से कुल जो ऑर्गन डोनेशन के लिए रिक्वायरमेंट आती है उसमें से 2 से 3% ही फुलफिल कर पा रहा है, ज्यादा नहीं कर पा रहा है, क्योंकि उसके लिए शुरुआत नहीं हुई ऐसा हम नहीं कह सकते, शुरुआत तो हुई है, लेकिन और ज्यादा अवेयरनेस की आवश्यकता है, और ज्यादा कार्यक्रमों की आवश्यकता है, जैसे पब्लिक अवेयर हो, पब्लिक में करने से दूसरे लोगों का जीव कैसे बचाया जाता है, ये भाव निर्माण करने की आवश्यकता होती है। अपने परिवार में मुझे कई दिन पहले मैं एक न्यूज़पेपर में पढ़ रहा था, ये जब कोरोना क्राइसिस गई तो महाराष्ट्र के जलगांव में एक 31 साल की महिला, वो कोरोना की वजह से उसका लंग्स फेल हो गया और उसके 2 बच्चे थे, मध्यम परिवार की थी और वो भी काम करती थी, मेहनत करती थी, कमाई करती थी, और उसका पति की भी वो भी एक सामान्य जॉब कर रहा था, लेकिन वो लंग्स फेलियर हो जाने से उसको डॉक्टर ने कहा कि आपको नया लंग्स लगाना पड़ेगा। तो उसका परिवार, सारी फैमिली ईश्वर से प्रार्थना करने लगी, घूमने लगे कि कोई हमें लंग्स डोनेट करने वाला मिल जाए। तो मैं गुजरात से बिलोंग करता हूं, तो एक बार गुजरात में कामिनी पटेल नाम की एक महिला थी, उन्होंने उसमें लिखा था, तो एक कामिनी पटेल का ब्रेन डेड हो गया था, उसका परिवार ने डिसाइड किया कि उसका तो ब्रेन डेड हो चुका है और ये महिला जलगांव की 31 साल की महिला, उसको लंग चाहिए, हमें देना चाहिए। कई लोगों ने उसको मोटिवेट किया, तो उन्होंने मोटिवेट होके, उसका परिवार ने मोटिवेट होके कामिनी बहन का अंग का डोनेट करने के लिए डिसाइड किया, और उन्होंने एक साथ में 6 अंग को डोनेट किया। उसमें से उन्होंने लंग्स भी डोनेट किया, किडनी भी डोनेट किया, लीवर भी डोनेट किया, कॉर्निया भी डोनेट किया। ये सब डोनेशन करने से एक व्यक्ति ने, वो तो ब्रेन डेड थे ही, लेकिन उसका परिवार ने जो निर्णय लिया उससे 6 लोगों की जिंदगी बच गई। ये छोटा काम नहीं है, दूसरे को जीवन देना। ऑर्गन डोनेशन एक केवल डोनेशन नहीं है, दूसरे का जीवन भी है, और इस तरह से हम जनता के बीच में एक कार्यक्रम को लाया जा सकते हैं। और मेरा तो यह मानना है कि यह प्रयास क्या ये केवल कोई इंस्टीट्यूट करे, क्या केवल कोई सरकार करे? डेमोक्रेसी का एक स्वभाव है, जनता, सरकार और ऐसे कार्यक्रम ऑर्गेनाइजर या तो मीडिया। डेमोक्रेसी में मीडिया की भी बहुत महत्वपूर्ण भूमिका होती है। हम सब लोग साथ में मिलकर एफर्ट करें तो ये एफर्ट का परिणाम ये आता है कि अवेयरनेस के आधार पर कार्यक्रम भी बन जाता है, नीति भी बन जाती है, पॉलिसी भी बन जाती है, इंप्लीमेंटेशन भी हो जाता है, लेकिन सिंगल दृष्टि से उसके लिए प्रयास नहीं होना चाहिए, कलेक्टिव एफर्ट होना चाहिए, सामूहिक प्रयास होना चाहिए। आज इंडिया की स्थिति क्या है देखो, 10 लाख हमारा पॉपुलेशन पर 1% से भी कम लोग ऑर्गन डोनेट करते हैं, और यही स्थिति यूएसए में देखो, 10 लाख पर 26 लोग ऑर्गन डोनेशन करते हैं। तो ये महत्वपूर्ण बात है कि ये परसेंटेज हमें कैसे बढ़ाना है। 10 लाख लोग में से ज्यादा लोग, क्योंकि बहुत बड़ा देश है, ये यहाँ ह्यूज डाइवर्सिटी है, और ऐसी स्थिति में एक्सीडेंट होना और कोई घटना होना, ब्रेन डेथ हो जाना, ऐसा होता ही रहता है। लेकिन उसके परिवार में ये भाव हम वहां तक पहुंचे, अभी शुरुआत नहीं हुई ऐसा नहीं है, लोग में अवेयरनेस आ ही रही है, धीरे धीरे बढ़ भी रहे हैं, लेकिन उसको इस दृष्टि से आगे ले जाना है कि देश के उसमें कई ऐसी घटनाएं हो जाती है सोसाइटी में, ये हमारे देश के लिए बहुत आवश्यक है, क्योंकि हमारे यहाँ अभी हम इतनी सोशल सिक्योरिटी नहीं दे पाए हैं। तो कोई गरीब परिवार हो, एक व्यक्ति घर में कमाने वाला हो, एक दिन में 300-400 रुपीस मजदूरी करके कमाता हो, और ये मजदूर को कोई ऐसी ऑर्गन की आवश्यकता हो और उसके यहाँ कोई ऐसी बीमारी हो जाए जिसमें ऑर्गन्स को रिप्लांट करने की आवश्यकता हो, तो ऐसी स्थिति में उसके पास नहीं फाइनेंशियल सपोर्ट होता है, नहीं उसके पास उसको कोई डोनेट करते हैं, और ये परिवार के व्यक्ति इस संसार को छोड़ के चले जाते हैं। केवल उसका परिवार सफर नहीं करता है कि अकेला जाता है, उसका परिवार 3, 4, 5, 6 लोगों का परिवार है, उसकी क्या हालत हो जाती है। उसका बच्चा पढ़ता होता है, कमाने वाला चला गया, उस बच्चे की पढ़ाई खत्म हो गई, वो पढ़ा नहीं पाई, उसकी माँ और कोई काम में लग गई, मजदूरी में लग, बच्चों की संभाल रखने वाले कोई नहीं बचे, इसलिए उसका परिवार का भविष्य धुंधला हो जाता है। मेरा मानना है कि वहां तक हमें ये ले जाना होगा जिसके आधार पर हम लोगों का जीवन को बचा सके। आज हमारे देश में करीबन 2 लाख पेशेंट का लीवर फेल्योर हो जाता है, और उसके लिए लीवर का डोनेशन देने वाले की संख्या कितनी है? बहुत कम है। जो कोई है उसको लीवर नहीं मिलता है और लोगों का मृत्यु हो जाता है। लेकिन जो लीवर डोनेशन में मिले तो 10 से 15% लोगों का तो जीवन बचाया जा सकता है। ज्यादा से ज्यादा लोगों का जीवन बचाने में हम कैसे सहयोग कर सकते हैं? तो मेरा मानना है कि कार्यक्रम मैंने इसलिए सोचा था, मेरा और कोई आज एंगेजमेंट था, लेकिन मैं ये कार्यक्रम में रहूंगा। ये कार्यक्रम में ताकत है, ये पब्लिक अवेयरनेस का कार्यक्रम है, ये ब्रेनस्टॉर्मिंग का कार्यक्रम है, ये नया आइडिया और नया सुझाव का कार्यक्रम है। इससे ये सब कुछ निकलता है। जैसे हमारे यहाँ हार्ट फेल्योर का कितना केस आते हैं, और हार्ट फेल्योर के केस में हार्ट को रिप्लांट करना है, रिप्लेस करना है, तो क्या स्थिति है हमारी? तो हार्ट रिप्लांट हो जाए, कई लोगों का जीवन बचा सकते हैं। और ऐसा ऑर्गन ट्रांसप्लांट के लिए सरकार की ओर से तो प्रयास हो ही रहा है, सरकार तो करती ही रहेगी। सरकार ने रूल्स रेगुलेशन कानून भी बनाया है, ये सब होते रहेंगे और सरकार तो और प्रयास करेंगी ही। लेकिन हम सब लोग साथ में मिलके एक कलेक्टिवली एफर्ट करके देश में ऑर्गन डोनेशन का एक अवेयरनेस बढ़े, लोग उसमें शामिल हो, लोग दूसरे लोगों के, वैसे तो ये हमारा नेचर में है, इंडिया का नेचर है एक दूसरे को सहयोग करना, एक दूसरे को मदद करना। आपको देखना और कोई दुनिया की भी स्थिति को देखना, एक्सीडेंट हुआ है तो इंडिया में 108 आएगी, तभी ले जाएंगे, तब तक वहां कोई खड़ा नहीं रहेंगे, पुलिस ही इंफॉर्मेशन देगी, ऐसा नहीं है। आपने देखा होगा रोड पे कोई भी एक्सीडेंट हुआ हो, जो भी लोग आएंगे वहां से पास हो गए, तुरंत ही अपनी गाड़ी रख देंगे, तुरंत ही उसको मदद में लग जाएंगे, कोई पानी पिलाएंगे, कोई ये मदद करेंगे, कोई वो मदद करेंगे, उसको तुरंत ही अस्पताल पहुंचाने की कोशिश करेंगे। हमारा नेचर में है सहयोग करना। लेकिन ऑर्गन डोनेट करना ये हमारे लिए नया विषय था। जब से तो 1970 से इंडिया में स्टार्ट हुआ, किडनी ट्रांसप्लांट का सबसे पहले शुरुआत हुई थी और धीरे धीरे ऑर्गन ट्रांसप्लांट की स्थिति और गति बढ़ रही है। उसमें जो अवेयरनेस जिस गति से आनी चाहिए थी, एक गति से नहीं आई। एक गति हमें और बढ़ानी है, एक गति को और आगे ले जाना है, और उसमें व्यापक पब्लिक अवेयरनेस करके, ये किसी को हम कंपलसरी तो करवा नहीं सकते हैं। हमें तो डेमोक्रेटिक कंट्री, आपको ये करना ही है ऐसा आदेश नहीं कर सकते हो। उसके परिवार को राजी करना है, उसके परिवार को खुश करना है, या तो उसके परिवार को मोटिवेट करना है। और जिसका ऑर्गन डोनेट करना है, उसके परिवार ही उसमें सहयोग कर सकते हैं। उसका परिवार मतलब कुल मिलाकर सोसाइटी का एक पार्ट। अल्टीमेटली तो इट इज वन पार्ट ऑफ सोसाइटी, ये भी एक सोसाइटी का ही पार्ट है। तो समाज कुल मिला के ये अभियान अपना बनाए, जिस तरह से आज इस कार्यक्रम के माध्यम से इस अभियान को अपना बनाया है, उसमें ऑर्गेनाइज करने वाले लोगों ने ऑर्गेनाइज किया है और बाकी लोग जुड़े हैं तो वो भी अपना कंट्रीब्यूट कर रहे हैं। जो लोग सुन रहे हैं वो भी अपना कंट्रीब्यूट कर रहे हैं, उससे जो कुछ निकलेंगे और उसके आधार पर कुछ आगे डिसीजन लिया जाएंगे, वो भी अपना कंट्रीब्यूट कर रहे हैं। तो ये सब हमारा सब लोगों का सामूहिक कंट्रीब्यूशन से ये रास्ता हम तय कर सकते हैं जिसके आधार पर हम दूसरे लोगों को नया जीवन दे सके। मुझे इस कार्यक्रम में उपस्थित रहने का अवसर मिला, मुझे बुलाया, इसलिए मैं आयोजकों का आभारी हूं। और इस कार्यक्रम में जो आज शामिल हुए हैं, डिबेट के माध्यम से, डिस्कशन के माध्यम से, जो भी अपना उत्तम सुझाव देंगे, ये सुझाव मेरे पास आप अवश्य पहुंचाइए। मैं मेरे से सरकार की ओर से, मोदी गवर्नमेंट की ओर से जो भी आवश्यक कदम उठाने की आवश्यकता लगेगी, हम अवश्य उठाएंगे। हम नया भारत में कोई लोगों को ऑर्गन्स नहीं मिलने से उसकी मृत्यु की नौबत न आए, ऐसी स्थिति को निर्माण करना है और उसके लिए हम सब लोग सामूहिक प्रयास करें, यही अपेक्षा है। धन्यवाद।
धन्यवाद मांडविया जी, थैंक यू सो मच फॉर ज्वाइनिंग अस एंड वी विल कंटिन्यू विद द पैनल डिस्कशन एंड जो भी सजेशंस होंगे हमारे एक्सपर्ट्स के वो हम मांडविया जी तक जरूर पहुंचाएंगे सो दैट द गवर्नमेंट कैन एक्ट ऑन इट। सो थैंक यू सो मच सर फॉर ज्वाइनिंग अस।
थैंक यू।
थैंक यू। Thank you so much all the panelists. The minister had to speak first, इसलिए we had to change a little the format of the panel discussion. But we will go back to Dr. Aarti Vij. She was talking about the situation in AIIMS and the suggestions overall on how to improve organ donations, particularly in North India, because as we were discussing that there's a huge difference between the organ donations happening in southern part of the country and the northern part of the country. So as a leading institution, AIIMS, what are you already doing and how do you plan to take it forward?
After getting the Honorable Minister's message, I thought for the limited time that you have, let's concentrate on the way forward. And each one of us, I have some ideas which I can share, and let's prepare a list of what we can do to ensure that some recommendations, some guidelines or policy decisions can help this program further. One of the things that when I realized in our case, there are 5 reasons. See, our brain that identification is perfect. We have a great team to maintain, screening, everything is all right. But there are most of the times I'm medically not suitable. So the clinical part is good, very active. A separate brain dead donor management team, I thought, adds a lot of value. But besides that, if we come to public awareness, as the guidance has been given to us just now, that there is lack of awareness. At our AIIMS research, we found still in North and in Delhi specifically, the topmost cause for saying no has been still the non-acceptance of brain death. The shock family goes through can be helped through grief counseling, but brain death acceptance is low, not only in general public, but also in medical professionals. People other than ones who are actively engaged in transplant program, the other medical professionals are still not that convinced. And when people go around talking to paramedical staff or their personal physicians, it's not that, yes, go ahead. If the doctor has said brain death, yes, you can go ahead and donate organs. There's still that confidence still lacking. So that's one factor. We have seen in our case, there is a religious factor also, that some people would not, they would say that our religion doesn't permit, or they have myths around rebirth without the organs and stuff. Despite the best of awareness programs, this still exists. We have also noticed, now I'm talking of the facts where we are just about to sign the consent and it doesn't happen. Divided family opinion. While the law mandates the person legally in possession of the body can sign, but if we want to create a positivity around organ donation, then we want the family to be part of it. So if the husband has agreed, the wife's parents will come and say, no, we can't push such families. We want that families should come together, and we've had that big issue with us. Fear of disfigurement existed for a long time. Now the counselors are capable of taking care of that, so that's not a problem anymore. In Delhi, another thing that we have noticed is migratory population. So this may be more applicable to AIIMS because we get patients from that category of population in our trauma center, where there's nobody to consent, though nobody next of kin is available. and they are either come from far off states, and then that is kind of a little issue that happens. I was thinking why there are no retrieval centers, and my suggestion is to improve the number of transplant centers. Transplant centers are focused in all big metro cities, and we don't have at state levels, like maybe every medical college in the country should start kidney transplant program, the least. And how fast we can train the surgeons if we make it mandatory for every surgical department to depute the surgeons on rotation to big transplant centers, even in private sector or in government sector, for 6 months, 1 year to get trained and start. So this is one of the initiative. If that will make it a normal procedure, so it won't be something extraordinary is happening. And at the same time, the hospital has to have its own interest in the program to be able to create awareness, to be able to even share organs later, even at the national level.
I think
one more point I want to make, that's it. So last point is, whenever we discuss about organ donation, we never have people who are like the providers of organs. I think we must have a brainstorming with intensivists, trauma surgeons, neurologists, and get them, because their buy-in and their interest is very important. And I'm very sure that wherever the program is successful, those teams are totally involved in the entire transplant program. To find out why people don't identify, don't declare, let's get them and have another brainstorming with them.
Sure. Dr. Mathur, I'll come next to you. We have often heard about the Bombay model, and Bombay was the first city to have the zonal transplant coordination center. So what has been the experience in Mumbai in terms of organ donation drive during the pandemic, and what are the things that we can learn from the Bombay model to implement it in other parts of the country to improve the system?
Thank you, Yogesh, for calling it the Bombay model. It's Mumbai, I will say it is a Maharashtra model. So let me clarify that when this the act was passed, 94, Maharashtra was the first state to implement this act. And it created a specialized body of a specialist involved in the kidney transplant and those who have been trained abroad and come back for liver transplants and the cardiac surgeons and all that, to guide the government how to go about implementing the provisions of this act and what to do. And that's where in 1999, the government of Maharashtra created independent bodies, which is called the Zonal Coordination Transplant Centers. And that was the first in the country. And I'll tell you, the first organ donation in the public sector in Maharashtra, in Mumbai, happened in 1997. Much ahead than other states. Now, the main purpose of this independent body, which is ZTCC, is to create the awareness about the organ donation and see the distribution of the organs. These were two mandates given to this body. And today I'm very proud to say that though both Aarti and Dr. Trehan was mentioning about South model, perhaps they include the Maharashtra and Gujarat in the South. That is the problem. The whole thing is that the Maharashtra since 2019 has contributed highest number of organ donation in the country. And as far as Mumbai thing is concerned, in 2019, before the pandemic started, our per million organ donation rate was 3.9, which was the highest ever in the country. Even during pandemic, with the proper handling of the situation by proper putting the guidelines and the SOP, which were prepared by the experts in Maharashtra, we could continue, though I said that 50% reduction in the organ donation rate during that, but it is maintained. So today, if you look at the figures, the Maharashtra and Telangana are the highest organ donation during COVID period in the country.
Yeah.
So that is about, and even Gujarat is picking up. Gujarat, Surat is a model where there is organ donation happening every weekly or more than that. So we should look at that. So now how we have achieved, that is what is important. So there is one thing is the public awareness, which was created right in the beginning, started from there, and that we started from 95. And the public included general public as well as the medical professionals. The second part of this model is the multi-pronged hub and spoke approach. Now, what is that? Dr. Shetty is sitting there. He understood what I am saying. We have a central body, and then all the hospitals which are doing the transplants are affiliated to this body. So they are part of the decision maker. And in this, the administrator plays a very important role. Dr. Trehan, this you should know that it is not just giving them, okay, I have given you the ICU, you do whatever you want. It is the follow-up every week, what happened, how many were there and how did they perform. That is important. So administration support is very important. And that's where the CEO of each hospital is a member of ZTCC, which takes the decisions. The second part, what Aarti was saying was right, in involving the intensive. So we have got a intensive care subcommittee under ZTCC. So in each hospital, it is intensivist who identify the brain death, who maintains the donor, which is important part. And then you cannot neglect the people who are going to certify brain death, that is neurosurgeons, neurophysicians, other clinicians who are going to certify the brain death, the patient's primary physicians, under whom the patient is admitted. If he says, I don't believe in brain death, or if he doesn't talk to the family in unambiguous language that yes, person is dead and there's no way you can save him, then it makes a difference. The third part, which is very important, and this we implemented again from 95, is creation of the medical social workers. We call them medical social workers come coordinators. It has come in the Act now in 2011. We implemented at that time that any hospital who wants to get registered for organ transplantation, including public hospital, have to have a medical social worker who will be working as a grief counselor come motivator. Now, this is a very important step in getting the consent. You can't ask the family that donate the organ. You have to first develop the rapport and win the trust. And that is a grief counseling. And then you come to the stage where you ask for the donation. Now, the other part, which is important, is a transparent system of organ distribution. Because if you break the public trust through your organ distribution, the public will back out from the organ donation. Okay, so that's what very important. And what Sunil Shroff was asking, why the organ donation in Tamil Nadu is going down. Kerala has touched the rock bottom. Okay, several states. They have to do interception themselves.
Yeah.
As far as trauma is concerned, trauma is we are not having, I analyze almost 20 years data. 60% of the donation is coming from the patients who are having a CVA, not trauma. And there getting the consent is much easier.
Yeah.
Okay. And the results of extended criteria donors are not as bad as they are thought to be. Okay. So that's what is the approach which should be applied. It is a public awareness, but the awareness amongst the doctors, involving every stakeholder in the processes. Then it works.
Thank you, Dr. Mathur. I will next go to Dr. Trehan. He has been listening about this whole conversation. And Dr. Trehan runs one of the biggest private medical institutions in northern India, the Medanta Hospital. It's one of the biggest in the country, in fact. So what has been your experience, Dr. Trehan, with organ donation, and what will be your suggestion to the government? What more needs to be done? How do we improve organ donation, particularly in this part of the country where I think we are lagging behind when we see the other parts? Dr. Trehan, you are not audible.
Yeah. No, I said, importantly, Dr. Vij and Dr. Mathur have brought out some very significant points which stress the fact that it's a full value chain. From awareness, from unfortunately the tragedy happening, where the tragedy goes for which hospital, what is the internal mechanism present in a hospital which can actually identify the potential donors, counselors. It's a full exercise.
Yeah.
And then also the doctors must participate in it, the treating physician and the ICU guys. So unless we have that whole chain present, then the chances of success would be less. But each region has its own peculiarities. So in the state of Haryana, we don't have a SOTO. We don't have a state organ transplant organization. The government is unable to get its arms around it. The doctors are the ones they have to actually designate Rohtak Medical College as the SOTO center. But the doctors of Rohtak Medical College are totally lost. They don't know. They keep going in circles. So there are many problems because of lack of constant knowledge and dissemination of information. So the government's role can be very importantly in mass educating the public about the benefits of organ transplant. That how, no matter what religion you are, if your tragedy can save 6 lives, that's what, or even more. You can have pancreas, you can have small intestine. So the point is that this is a constant effort that we'll have to make in public awareness. Needless to say, beyond that, the hospitals will have to, and Dr. Shroff is here, Dr. Rella is here. I think that maybe a small committee of knowledgeable people, and I don't qualify for that, who are knowledgeable in this field, should actually create that white paper as a consequence of this discussion, so that we can all share it with each other. If we have to add anything to it, do it, and then expressly send it to the minister while the subject is fresh in his mind. He is a doer. So if we can actually put it together in a way, and all the experts are here. So I would request that if at the end of today, whenever this meeting finishes, we should have that paper written by the experts, and be happy to see if I can add in anything to it another time. But I'm the least qualified on this panel. So thank you for giving me the time. Unfortunately, I have to get back to the operating room. So I will look forward to this guidance from everybody, and commit myself to recharge our entire system and see internally what we can do. But Aarti, on the other hand, we need to, being in the same region, we need to be engaged on a regular basis, including what Noto is doing, because Noto is then devoid of any inputs from us and anybody who's grabbing at what. But I don't even know what the numbers are, because they're saying it seems pitiable how many organs are actually given out by Noto. So thank you for this opportunity, and more importantly, thank you for the opportunity to listen to all the experts. And I become that much richer, and I hope to engage with you again. Thank you so much. And
thank you so much.
Please continue.
Thank you so much, Dr. Trehan. We'll certainly share the inputs from the experts, and we will continue. We will want to have a continued support from you on how to augment the organ donation drive. So
no,
thank you.
Committed. I'm a committed soldier to this. That I can do again. But thanks everybody, and bye. Have a good discussion. Thank you.
Thank you, sir. So, Dr. Shetty, my next question is to you, sir. As a private hospital, you are a leading private hospital conducting organ transplants. What are the specific challenges that you face in terms of getting organs from different centers or conducting the transplant? Has there been issues with approvals, delays and all that? Because that is one problem we often come across, like as complaint from hospitals.
Thank you, Gurkesh, for that question, and it's a privilege to be a part of such esteemed panel. Now, as far as private hospitals go, and especially in the region, there are a set of hospitals which are obviously very active in the organ transplant program, like Dr. Trehan's hospital, Dr. Rela's hospital. So these are hospitals where I think we have appropriate structures in place. We have the brainstem death committees in place, we have grief counselors, social workers. So in terms of identifying brainstem deaths as well as counseling patients, I would say we have a much better infrastructure, and we do follow this approach of declare all and approach all. So as far as possible, we do take that approach to declare all brainstem deaths. As we move further away from the larger private hospitals, I think that's where the whole challenge then begins to start, because we have, of course, identified a large number of non-organ transplant retrieval centers, and we need to see how more and more private hospitals can become a part of this network, because now we have teams in place to go and retrieve organs, and that's where the ZTCC and Dr. Mathur stressed on that point. In this part of the country, I think we've done a wonderful job, because we have this committee in place which kind of coordinates between all private hospitals and identifies which hospital will go for the retrieval and how the organ distribution will take place. So that, I think, has made a significant difference as far as reducing the obstacles and bottlenecks in the process. And that's why I would say Maharashtra and Mumbai has now begun to really take leadership role. Of course, the pandemic has been a bit of a setback, but we are already seeing very quick recovery. So to me, the biggest issue will be in terms of private hospitals, how do we get more and more of them to become retrieval centers and have a transparent mechanism to retrieve and distribute the organs. The one other suggestion that we discussed as part of this panel was, how does private sector work with the government to set up transplant programs in the government centers? I think that is very, very critical. The Honorable Minister mentioned that we need to get to a point where no organ goes waste, and we know that in the public sector there are huge opportunities which are getting lost. At the same time, we need to make transplant accessible to the common man, and that's where private hospitals can either help in setting up these programs, or as one of the other panelists suggested, do these transplants free of cost for poor patients in private hospitals. I think these are some of the ways that private sector can work together to reduce obstacles and ensure that no organ actually goes waste.
Thank you so much. Dr. Rela, we have been discussing that how government sectors, we don't have enough transplant centers, and there's no motivation for the hospital doctors for retrieval events. So we have less retrieval as well as transplantation in the government sector compared to the private sector. So what will be your suggestion? Do you agree that we should have a system wherein poor patients can get transplants done for free in private hospitals, or what else needs to be done? How do we improve the system?
We saw that most of the donors are actually the potential donors are in the government hospital, and there are less potential donors in private hospitals. I think where there is potentially a better utility of these organs. I think if we see organs as a national resource, and the hospitals and individuals or doctors don't see it as what's in it for me, if they don't see it, what is the benefit for us to declare this donors? I mean, we used to have this problem with neurosurgeons and neurosurgical field where they felt it was not appropriate or right for them, or there wasn't anything in it for them to declare. So if we change that attitude and see organs as a national resource that is going to save somebody else's life, then that fundamental principle is enough to improve organ donation. So the next thing is about we had a huge discussion in the Liver Transplant Society of India about public sector not actually improving their transplantation rate. And as soon as the public sector improves, the donation rate is automatically going to improve. I think it's wrong for us to think that the public sector does not have the resources. I think the public sector does. The government hospital have all the resources. In fact, I feel they have got better resources than the private hospitals who have to put resources through their patient care. And it's just us getting things sorted out so government hospitals can successfully do transplants like heart and lung and liver. They're already doing the kidney, if that happens. But if that's going to take time, I think the private sector has to pitch in to develop or help the public sector to transplant. You all said, oh, the private sector can do transplantation for free for the poorer patients. I mean, I think that is very good, and I understand it's a possibility. But if private hospitals are going to do free transplants for the poorer patients, they're going to charge. Where is the money going to come from? The money has to come from other patients. So they're going to charge more for the other patients in order to do the free transplants for the poorer patients, and it'll only be a fraction. I think the Tamil Nadu government, in fact, funds transplants to be done in the private sector. both in the public sector as well as the private sector. And you will be surprised to hear that the number of transplants done funded by the government in Tamil Nadu is probably equivalent to the private transplants done in the private hospitals funded by individuals. So the government has the capacity to actually fund. The Tamil Nadu government provides, I think, 18 lakhs to begin with for I don't know about the kidney transplants, for liver transplants, and up to really 25 lakhs for heart and lung transplants. So the government does have the resources. If Tamil Nadu government can do it, any government hospital can do it, and the organs will be available for both the rich and the poor equally in both the public hospitals as well as the private hospitals. There is a way forward. And I'm extremely grateful actually to Times of India and the Kokilaben Hospital for this discussion. I think more and more discussions are necessary, and for people like us to able to meet and bring out the problems. Sometimes we bring out difficult problems which are difficult for people to digest and even for the government sector to digest. And I'm very grateful for that. And I think there is a huge way forward. And if the private sector and the government sector cooperates, I think that will improve both patient care as well as improve organ donation in our country.
Thank you. I'll next go to Dr. Shroff. He has been listening to all the conversation, and I'm sure he has a lot of views on the subject, not just from the organ donation perspective, but also in terms of infrastructure development to be able to conduct more transplants, whether it is in the government sector or the private sector. He has been involved in a lot of work to create awareness about organ donation and also coordinating with hospitals on how to convert brain death into organ donation, cadaver donation. So Dr. Shroff, please enlighten us with your views on the subject.
So thank you very much. Thank you Times of India, and thank you Kokilaben for this opportunity. I'm audible to you, Durgesh?
Yes, sir. You are.
Yeah, sure. So I know, we as the foundation, we have been around for now 25 years, and we've seen how this program has evolved. We used to do less than 100 donations at one time, and now we do close to 600, 700, 800 donations every year. So definitely we have moved forward, and we've seen the key here is how do we increase our donation rate. I think that's what should be our focus in this discussion. Awareness should continue, absolutely no questions about it. But these are like parallel tracks, Awareness alone will not going to do the job. Our impression in this 25 years has been that we need to also look at how to increase the donation rate as we have been talking, in the government sector hospitals. Because as we have discussed previously, the donors from medical legal cases, from road traffic accidents, by and large land up in the government hospitals. The priority for organ donation or transplantation in government hospitals is very low because they are so busy with other things. I don't blame them. If you look at the casualty, it's filled with variety of cases, and organ donation is very low on their priority. Transplant is very low on their priority. So we need to look at how to do capacity building in these government hospitals. There are 540 medical colleges today in this country, of which almost 300 are government medical colleges. And if we are able to do even one donation from each of these, we get 560 extra donors from these hospitals. And all government medical colleges have the infrastructure to do a transplant, believe me, and do a donation. They have everything in place. So, we need to look at, on a policy level, we need to look at how to do this in the government hospital. What we do in the government hospital is different. How do we do how do we increase the capacity is different. But on a policy level from the government of India, that mandate has to come from the minister that yes, all government medical colleges starting from today are going to become at least retrieval center. And the next step will be within a year, you'll start doing transplants as well. So that mandate has to come from them. And this mandate is required. Why? Because, we have today, our kidney failure rate is very high. The Pradhan Mantri National Dialysis Program, which was started in 2016 and again given a boost in 2018, hopes to cover 718 districts with hemodialysis centers in the country with a public-private partnership, which means that we will need to do 3.8 crores dialysis every year. At the moment, we're doing less than, 10 lakh dialysis a year in all these government colleges, government hospitals. So we need to look at how to do the capacity building. So that mandate is already there. The Ayushman Bharat scheme wants to cover 40 crore Indians who are not affordable to do transplants. They're already providing 5 lakhs for these transplants. They already have a budget for that. Many state governments are doing it. So there is an opportunity to do something in the government hospitals to build the capacity so that they can do at least kidney transplant to start off with before they graduate to liver and heart transplant. And we have some excellent example of public-private partnership in places like Tamil Nadu, in Maharashtra perhaps, in other places too. And similar models can be duplicated in other states. So my suggestion is today, if you look at what we need to do is we need to make these hospitals empowered to start doing transplant. And if we do that, then many of these transplants, once they start happening, the equity, which is now, not distributed properly, equity is more towards private sector in transplant, will go to the government as well. And that will build trust in this whole program as well. Because trust is very important, and Dr. Mathur has spoken about it, and many of you others have spoken about it. This trust is lacking. And this trust needs to be restored. And the only way we can restore this trust is people who are less affordable also start getting transplants. They're not denied a transplant. So this is what we need to do. This capacity building is extremely important. And I want to shift the focus to, awareness is good, you continue. But we are talking about green corridors today on the roads, for transplants. We need green corridors in hospitals today. We need procedures in hospitals today so that when there is a donor, it's not an unusual event. It's an usual event in a hospital. Organ donation should be a usual event. And there is a lack of procedures in most hospitals which fail to do transplant. So these green corridors we need to actually establish in the hospitals if we want to really move this program forward. And the awareness we are talking about, awareness is equally important among the medical staff compared to the public. Believe me, if you look at the eye donation rate in this country, it is 38 per million population. 90% come from home retrieval. It's not a small number. That means the public is giving. We have more than 500, per million donation rate in blood donation. And then again, it's voluntary. These are all voluntary donations. So in our impression, we need to really forget about saying that, create awareness in the public domain. All that, and that is what is missing. That is not what is missing in the picture. What is missing in the picture is our procedures fail in hospitals to support the family towards organ donation. Believe me, families don't even get asked. If you don't ask, how will you get yes for organ donation? Most of our procedures fail. We get calls on a helpline from many willing families which say, our loved one is brain dead in the hospital. Nobody's even coming forward. Believe me, we get such calls on a helpline today. So there is a procedural failure in the hospitals, and we need to correct that. If you do these 3-4 things, I think we will definitely multiply our organ donation rate in no time. So let the awareness continue in the public sector. That's fine. Continue doing that. And today, if you look at the overall scenario of the country, of the 37 states and union territories we have, only 16 do disease donation, and that's why our figure is less than 1. Cities like Chennai, cities like Bombay have a donation rate of more than 15 per million population at any given time. And if you translate the same 15 per million donation rate for the rest of the country, you believe me how many organs we'll get. So in pockets, we're doing excellent. So 16 states and union territories only are doing disease donation. What is happening to the rest of it? Nothing, zero. So we need to empower these places. And this is where NOTO comes in as a body. They need to look at this, and they need to look at these gaps. How can, in each of these states which are missing from the, national picture, how can we get at least, one medical college or one hospital in each state start doing disease donation? We have to scale up slowly. So there are many, many suggestions. All the ingredients are there available today in this country. Every state has done extremely well, but in small bits. Yeah. So we need to really have a discussion like we have had today, so that we can come to some conclusions, put a roadmap forward and say, these are our priorities, these are our policy changes, because we have an excellent law. There's nothing wrong with the law. The law is working. We have a very strict mechanism for certifying brain death, which is good, because the lack of trust in this country requires such a law, to have a tough law. But despite all the problems, we're able to move forward with the law. So we have the law today, we have the regulation today. Implementation is not happening. That's where we're lacking.
I think you are right, sir. And
procedures are not happening.
Yes, sir. So we have got many suggestions from all the panelists, and we will certainly collate all the information together and maybe share it with the minister so that the government can act on it, because we can discuss, but unless the policy is worked at the government level, it is introduced and it is examined fairly by the government, it's not possible to improve the system. Like we have suggestions such as we should have more retrieval centers. Public awareness, of course, needs to go up. Medical college resources in the medical colleges need to be tapped on to improve the donation system. We have to build trust. I mean, we need to ensure that people trust that we are doing the right thing by seeking donations and conducting the transplants. So it's a good suggestion as well. And procedural failure, and we need to improve it so that the hospitals, more hospitals can do it, and people willing to donate can donate it. So I believe with these suggestions, I would end the discussion here, and we hope that this effort goes on to improve and augment the organ donation program. So thank you everyone for joining us here in the Times Organ Donation Drive. So thank you so much. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you for
Thank you.
being a part of this.
Thank you, doctors.